Today we have with us Dr. Jinal Gala, co-founder of Synergy India, based in Mumbai. She's a UK trained sports physiotherapist, and she is known for her expertise in performance-based athlete rehabilitation. So, welcome to the podcast, Dr. Jinal. I am very happy to have you here.
I'm really happy to be here. Thank you for having me.
All our podcasts generally start with questions and conversations, and the conversation that started this for us was, physiotherapists choosing sports as a specialty way too soon before they can understand if this is the right fit for them. So I just wanted you to expand on what you meant by it and what were your thoughts on it.
I think, because ever since I have been working as a sports physiotherapist, I've met so many young physios who every time they would meet me, like probably they're like in third year or fourth year of still doing undergrad, they would be like, oh, I would love to be a sports physiotherapist. And I've decided I'm going to go to like a XYZ university or so. And they're so much in rush to sort of jump from undergrad to postgrad because they feel like that postgraduate degree is going to just make them sports physiotherapists. And of course, on paper you're quite on it. However, I personally have always felt that, and also this was a golden advice that I had gotten when I graduated, was that if your undergrad skills aren't really like used, or it wouldn't really make you think critically, or you haven't seen the musculoskeletal injuries or orthopedic injuries enough, to jump from there to an athlete is a very big leap. And over that, even if the first jump feels quite big and you land quite safely, the overall experience of like your career can be a little different than what it would have been if you would have just paused a little bit and just take a little bit of an experience and then thought about your specialization or super specialization, for that matter. So I think this, because it's come to me so many times, I personally have always felt the need to tell people that maybe this is not always the correct way of going ahead.
What do you think are the underlying reasons that would push physiotherapists into sports physiotherapy early without understanding it fully?
I think one of the important and the most common ones is, I think, glamour of the field. When we look at sports physiotherapy, you suddenly feel empowered because you're working with these really fancy athletes working at different, like when you think of sports physiotherapy, you almost imagine yourself training like a national level sprinter, or a cricketer, or like, I don't know, you see yourself running on the field because that is what we see on the internet and on the television. And I feel like because the field has been so glamorized that you almost feel like, okay, let me just quickly do this because I can be there. The second big reason is, and maybe this is quite limited to brown population to begin with, and maybe I'm generalizing a little bit, so like this is not in an offensive way. I personally feel like there's so much of social expectation from you that you should finish all your education at once and then jump onto working later. It works quite fine when it's a very technical field, but it does not always work fine in a service based field, because service based healthcare field requires hands on experience, patient interaction, seeing different kinds of injuries. The more you learn, like I'm so much better than what I was 5 days ago because I have seen those 5 days for new patients probably. So I look at it that way, that year on year, day on day, week on week, you just get better.
Yeah, I think glamour of the field and probably the financial incentives that people associate with it. Uh,
Yeah, yeah.
yeah. Can you, share some situations where you think, that somebody jumped into sports physiotherapy earlier than they were ready for it?
I'm just going to say this because this has been my personal experience. When did my master's, which was a couple of years after my undergrad and me working, our cohort was really small.
Hmm.
And probably like, I think we were 10 of us in the batch for the entire master's. And out of which there were a couple of them who did their undergrad and they jumped straight into master's, which was MSc Sports and Exercise Medicine. And to be really honest, that course was quite full on. Like they just bombard you with all the information available out there, right? And I saw so many people who struggled with their assignments, not because they were daft, like they were really smart people, but because they couldn't associate themselves in the kind of clinical scenarios that masters would put you into. Like they will tell you, like, what if there's a cyclist having a trauma injury, what are you going to check for? But if your brain is not wired to think that way, because you haven't seen enough athletes, you wouldn't really know that there's psychology of it, there's pressure of the game, there's temperature, there's positioning, there could be a traumatic experience of actually having a life threatening injury, all of that. So I personally felt a lot of my colleagues sort of struggled during the masters, and a lot of them left sports altogether just after the masters, and
Hmm.
which made me feel like that experience got a little difficult for them,
Hmm.
because pre-existing, because undergrad में नहीं सिखाते sports,
Hmm.
unfortunately. The only thing we learn in undergrad is base, and that base does not teach you sports. In India, we don't learn sports as a subject in undergrad. So I felt like there was a very big jump that happened, and for them it was maybe a false reading. Maybe they could have just done better 2 years after, right?
Right. Right.
So that was one thing. The other thing is probably when I see all these young physios right now, managing things on field just after, I don't know, like 6 months of internship, which is a mandatory academic internship. I see these people, they look at athletes as athletes to begin with, but their injuries, they wouldn't go in the depths of the injury. Very superficial training. They wouldn't think like, कि इसका re-injury हुआ तो they will lose a very big, like career ka span, or it will affect their overall performance or psychology. There's so many things, there's so many stakeholders in it. So I feel like that premature handling of injury happens if someone just jumps onto something quite early on.
So let's say that someone does want to and is looking for to commit into a pathway of sports physiotherapy. Ideally, like in an ideal scenario, what would that pathway look like according to you?
I feel like after undergrad, I would expect someone to have some years of work experience.
Right.
The experience can be in a mixed format of you going on field, either independently or with someone. You would probably like work in sports clinic, MSK clinics, orthopedic setups, or you would like try to do as much self learning as possible, because I feel like applying what you learn in undergrad is the perfect foundation to build something more. Like the example that I give people a lot often is that if you have not seen an ACL injury in
Hmm.
a normal population,
Right.
uh, then you would not be able to do the best work with a footballer who has an ACL injury, because I feel
Right.
like your brain would just be very straightforward कि यही करना है सब में,
Uh-huh.
which does not work. I mean, because the needs and the demands of those two people are so different. If you
Different. Yeah.
haven't seen enough of the baseline, you'll not be able to push yourself to having a little bit of accelerated work with the athlete. So I feel like a few years of experience. For me, I knew for a matter of fact that I wanted to at least get 3 to 5 years of experience before jumping onto masters, if at all that was required, because that was something that was not very mandate for me. Because touchwood, I had mentors who taught me these things quite early on. Ki
Right.
masters does not really decide your skills, or does not decide how good are you going to be at your work, because everything that you learn outside of a classroom is what actually really matters in the real world. So, and then jump on to masters depending on where you're interested in. Like, I think sports also, like, just to make it a little easier for people who are hearing this, is you can be on field, you can be in clinic, you can be in a performance gym setup. You're still going to be a sports physiotherapist in all three setups. So if you're interested in performance or on field, or just managing injuries in clinic, uski upar you can just decide like what kind of subjects you want to pick up for your masters, or what kind of certifications you want to add on do. Like for me, I was very clear by the end of 3 years of me working that performance is something that I really enjoy, and I know that I'll wake up at 6 a.m. in the morning not worrying about it. Like, I'll just be happy about it.
Yeah, that would be really nice if we had such experiences and then got into the studies of those
Yeah.
fields. Yeah, yeah. So I think, like you said, the glamour of the field is something that draws people into sports physiotherapy. And let's say that people have that glamour of the field because it's going to be there. You cannot cut it off. And
Yeah.
then they also go ahead and have these experiences. So how would you know internally that what is the motivator for you to get into this specialization?
Um, I think it's hard to understand what is your motivator. However, at the end of the day, it's really important to realize is that when you work with athletes, you're working with microseconds of
Right.
things going right or wrong for you, which
Right.
itself means that this field itself is very non-forgiving. Like, like whatever you do can make and break someone's really hard earned effort. I don't know, since they were like 8 years old. Like, I've had all these really elite athletes who have worked since they were 8 years old. They have done everything correct. And if you do one thing wrong, and or if you just under deliver, you're just going to change someone's life. So I feel like no matter what your motivator is, like when I got into it, I always thought that I really enjoyed when I was an athlete. So I felt like that if I get into this, I can actually just sort of relive what I lived when I was an athlete. Then when I got into it a bit more, I realized that actually I'm really good at it because I can actually perceive person's really like passion of field, and I could actually help them more because I felt like I could connect with them. And then when I got a little bit more into it, I realized that actually, while I really understand their passion, I actually can really help them into getting better in performance. So I felt that over a period of time, my motivators were really different.
Different.
But actually, at the end of the day, it what really mattered was that an athlete is a human who has put so much hard work into doing what they are doing right now,
Right.
and you should be the last reason that things go wrong for them. Like,
Right.
so
Right. So really understanding the stakes. Uh,
yes,
yeah.
and for the knowing that some of them are irreversible, like
Yes.
like what
Yes.
if you don't prep your athlete for that one important tournament, and you constantly feel like I have had days where I felt like I've gone back home thinking like I could have done a little bit more. So I would just go and read up a little bit more because I
Hmm.
feel like that I can deliver more because the person deserves to receive more, right?
Hmm.
And I feel like if you're not going to be in that mindset, if that is not your motivator to actually keep your athlete at the top, I don't know what other motivation you have, because no matter how glamorous this field is, it is
Hmm.
very unforgiving. Matlab, you
Yes.
can be replaced the next day despite being the best here.
Yeah, yeah. I think that should be like the biggest motivator. If you're ready for that, then that talks
Yeah.
about, whether you're really ready for this specialization or not.
Yeah.
So I think we spoke about how we can potentially choose sports as a field. So work experience and seeking out experiences, even in like a hyper specialty mode, are some of the things that you recommend doing before choosing sports as a specialty. Now, let's say that a person has done that, and they have either gained the work experience by working in these environments, and or gone ahead and after this gone ahead done a master's or done a course, right? And there's like a basic learning that has happened at that point. How should that person then take responsibility to keep on learning and be abreast in their field? So how would they build on their expertise, so to say?
A very different way of answering this would be that healthcare as a whole, if we leave sports aside for a little bit, is evolving field. So
Yes.
right now, if I'm looking at, like, let's say a hamstring injury, which is very common amongst most athletes from different genres, I feel like uh, the management of that injury has changed over a period of time. Like, I
Yes.
was just talking to someone whose lecture I had attended a few years ago about hamstring injuries. I just told that person yesterday that, oh, that was such a brilliant lecture. I still use so many of those things that you mentioned in the lecture. And that person said that, but that was actually 5 years ago. Things have changed so much. And it made me think for a little bit that when the person who is ready to deliver that knowledge still feels that every single day needs to be updated about what's going on new in that field, I feel like this is what the whole healthcare is about. And
Yes.
then when you then put sports into it,
Yes.
you're not only looking at the healthcare rules of it, like, of course the injury management will change over a period of time. There have been, I don't know, like zillion changes in ACL management since I graduated till now. But also there are changes of rules in the games. So there are smaller things you just need to be updated about. And I feel like having those fixed CPD hours for yourself, like where you're just continuing to like learn about these changes in the field, is so important. Sometimes it becomes difficult to keep yourself updated. What I tend to do a lot of times is, there are so many podcasts, where you can just like listen to them when you're just walking, traveling, or you're just like, having a lunch or something. Because that is not, because like I feel like the attention span of people has reduced so much that if you get more information in audio format, you're just
Yeah.
going to absorb a lot more. So I feel like you should just have fixed day in a week where you'll just listen to, like, let's say, like my favorite sport is, let's say, football, and I
Mm.
just love to hear some people who are in football talking about injury management.
Nice.
Or there are days where, let's say, recently I got an injury which has been the second of that kind of an injury in my last almost
Mm.
decade of practicing. I went ahead and I read about it. Now
Mm.
there's chat gpt. You can literally have conversation with chat gpt, like, so this is what I have been practicing, and these are the changes that I've noticed. Are there any particular new, like, new research that has happened? So I feel like there's so much more that we have access to. All we have to do is actually utilize and just upgrade yourself over a period of time.
Right.
There have been really great sports physios who have not done masters, literally
Mm.
done undergrad and just worked throughout for
Yeah.
last 20 years. But these people are so updated with what is happening over a period of time, because there's no other way to it. Like,
Right.
um yeah, I mean, I just feel like you have to dedicate time to just read about things or hear about things or just learn new things.
Would you say there are some daily non-negotiables that you should do to, keep yourself updated?
I think the daily non-negotiable is self-reflection to begin with.
Excellent.
Honestly,
Excellent.
if I go home thinking that I've done everything perfect, there's
Hmm.
something wrong with that. Because
Right.
if you think that you've done everything perfect, that means you're not really thought about what could have been better
Right.
in that particular scenario. I sometimes go back thinking like, oh, I could have done a little bit more, and
Hmm.
that one feeling keeps me grounded, but also keeps me curious to learn a little bit more every time.
Excellent.
Um, there have been times where I just would sit with my colleagues, uh, talking about, because I feel like talking about injuries probably that they have not seen, only because I can just get a third person perspective into
Hmm.
understanding what I have missed. So I feel like the non-negotiable is just to be do have that, self-reflection end of the day pay.
Mm-hmm.
um, Weekly non-negotiables for me, especially because I feel like week on week you can do this more sustainably and bit more realistically, is actually having a read about at least one article or one injury management that you saw the entire week, so that
Hmm.
you're just not doing blind practice, but you're actually doing a bit more informed practice.
Right, right. That's an excellent answer. And I think I love that it did not come with this is one, two, three, four things that you should do, but it was so simple that and it was so powerful in that same sense that it is just self-reflection of what you did well, what you did not, what you could do better. And
Right. And it's also like sort of keeping your ego aside for a little bit and thinking like, maybe I don't know enough things. And it is
yeah,
not practically possible to know each and everything about every injury, and
yes,
every
true.
subtype about the injury. But to have that little ego aside to think like, oh, maybe I just don't know, and to read a
Hmm.
little bit more. I
Hmm.
think this is something that, we try to do at Synergies. That's sometimes we tell people and patients like, no, we don't know. We'll go
Hmm.
back, we'll read about it, and we'll come back, because I don't want to give you a half-hearted answer or a half-informed answer, because again, at
Right,
the end of the day, it's your life that
right.
we have responsibility for. So
Right, right. Absolutely, 100%. So we spoke about learning beyond the initial learning of a subject or specialization, and we spoke about daily habits or weekly habits that you must do to update yourself. Now, I want to ask you about one, the role of clinical reasoning, and how can we practice clinical reasoning on a daily basis or a regular basis, let's say, to make us better.
I feel like clinical reasoning has been a very hot topic right now. I've had this discussion yesterday, a week ago. I think we've just been discussing about this so much. Um, um, to begin with, I feel like, for people to understand that the clinical reasoning is a non-negotiable is so
Hmm.
important. Clinical reasoning is actually, to be honest, not a part of our curriculum.
Hmm.
We are taught, like sort of we're taught theory, we are taught some practical, and we're just
Hmm.
asked to execute it.
Yeah.
But at that little bit of a cognitive level, to think about like, why am I testing this? Why should I give this particular treatment? Has this worked for me? Has this worked for the patient that I'm trying to execute on, if this does not work, why it must have not worked, but should I try something else? There's so much of that in between thinking which is so
Hmm.
important, that I feel like sometimes you sort of feel like there's a protocol and you have to execute the protocol.
Right.
But the most important thing is that human body is so variable. Just bringing it to the sport level, a badminton athlete is so different than the lawn tennis athlete, even if it's a racket sport. You know, I'm looking at the weight of the ball, the weight of the
Hmm.
racket. I'm
Right.
looking at like what surface they are playing on, how long
Hmm.
does the sport go on for, what kind
Hmm.
of, sort of strokes are going to give
Hmm.
them points. So there's so much more that I'm thinking about, and
Hmm.
that is why my protocol on a badminton athlete versus a lawn tennis athlete is going to be so different.
Hmm.
And I feel like that kind of blend into critical thinking and the clinical thinking is just not taught. But if you never think it's important, it's not going to come to you.
Hmm.
And I feel like we have been really trying to actually tell all these young upcoming physios is that one skill that you need to have is clinical and
Reasoning.
critical thinking. Both of them, like, I feel like if you can be the best student in the room who can write the theory paper perfect, get nail all those grades, you can be that one person who will nail all the practicals. But if you don't know how to blend yourself in your experience, in your skill and knowledge, it's just going to be so difficult. I met with this one of the top physios who was working at BCCI yesterday,
Hmm.
and he told me this one line which is going to stay with me is that if you believe that your clinical and critical thinking and reasoning is strong, you don't have to worry about um, all the fancy rehabs which are going in the market.
Right.
Because you would be able to pick the injuries so much better, so much faster. You will be able to predict what is the rate of re-injury and going to prevent those injuries so much better, that you have done everything that an athlete needs from you perfect. And that is all coming from your skill of clinical reasoning.
Excellent.
And I feel like that one skill, I had learned, I think, a few years after my work experience. But I feel like that changed the way I was thinking about rehab so much, because then I no more had the pressure of knowing it all, because now I'm actually trying to think about what I know and what is expected in the result, and then just try to reason things out a little bit better. So yeah.
Nice. Nice. I think I want to ask you next, what are the indicators that a physiotherapist is evolving in their specialization and they are not being static or stuck at the same level of work?
I think I mentioned this earlier, is that I think about it as, if I get a similar kind of injury today, I would think about like whatever I've done in my last patient with a similar injury, let's say a year ago or a few weeks ago, have I evolved from there? And I'm not
Excellent.
saying that drastically my management is going to get a little different or whatever, but I'm thinking more from the point of view is, did my thinking get a little faster in this? Was I able to adapt a little bit better? Were the kind of exercises that I'm trying to give very different for this athlete in the terms of more sport specific versus what I gave to my different kind of sport specific athlete?
Hmm.
So I think it's more of comparison than anything else.
Right.
I feel I'm very strongly opinionated about this is the number of certifications you do, number of, I don't know, like courses you attend or workshops you attend is only adding to your knowledge. But the blend of your knowledge and skill is where you actually excel. No one can take a skill away. People can add on to knowledge, subtract to knowledge. So yeah, that should be the indicator.
Nice, nice. That's a good indicator, I think. Yeah, I think we can apply that even across fields to, let us say, simply an OA knee patient that I might be seeing in a center. Then I can still
Yeah.
apply that and say, am I doing the same static quadriceps for this patient? Am I thinking
So yeah,
differently?
yeah,
So,
yeah,
yeah,
yeah.
how am I do you thinking
I
differently? What are
I
the
think this
factors?
also, like sometimes you feel like you want, like, sometimes you have the pressure, like, when we started Synergy, the whole pressure was we have to be better than other people,
Right.
like we have to be the best in the market. Why should a person visit us and not someone else? And we
Correct.
constantly feel like your validation comes from outside,
Right.
but it should not be like that.
Mm,
Like you should in your heart feel so safe and so secure when you go back home, thinking that you have done the correct thing by your patient. You have given them the most upgraded format of rehab, the most evidence based rehab, and you've done everything so correctly that you would maybe you've not done when you were just a fresh graduate. If you can see that difference, then that's
Excellent.
about it.
Excellent. What is the practice mind shift that you have implemented personally? And with that mindset, you've improved your patient outcomes.
I think whatever a little bit of business management or clinic management that I learned was from my previous employees,
Mm,
and fortunately, I've got employees in Mumbai, and I had got some employees back in UK as well, and the mindsets were really different, on both of them. One important thing that I learned from UK, which I couldn't learn here, was that you don't need to have the fanciest degree or the
right.
fanciest certification to be good at your work. you
Right.
know um, in I mean, all our interviews that we have had, of course we do ask for CVs, because
Mm,
we still want to verify
mm,
what's your base degree, etc. But all the interviews that we have done have been 95% clinical, just giving them
mm,
different scenarios to understand. Again, not saying what is the right thing to do, what is the wrong thing to do. We have shifted an entire focus on, can this person actually think beyond textbook? Because
right.
I feel like that your entire career, you will realize this one thing is that there's so many things that you learn, but there are way too many things that you execute which you've not really learned, and you
Right.
learn only from like over a period of time. Also, both Mahima and I, when we actually mentor people at the clinic, or when we meet young blooming, physios, one thing we tell them that there's no right or the wrong way of managing a patient. You
Mm,
know, uh, you can be really bad, and that's wrong. But if you are not really bad, you are doing probably the right thing that you think is for the patient, because your end goal is still the same, right?
mm,
So if you reach in a plan A by plan B, you're still doing the correct thing. So
mm,
I feel like Mahima and I, we both want to just see that, do they know that there's not only one single way of doing this,
right.
so that is something that we have shifted our focus from. So I don't care if they have a master's degree, I don't really care if they have done all the correct, not
Mm,
correct, like society approved correct certifications that they should do.
mm,
All
mm,
I want to see is that, are they able to reflect, or also are they able to have the listening skills?
mm,
Sometimes you're so good, but you don't have the listening skills for it. Like, if someone would just sit and tell you, like, but you could have just done this, or this is what I actually tried and this helped me, and they would just go like, no, but this is how I do it. That means you're rigid on it. That means
mm,
flexibility molding nahi hai.
right.
I can't You can't be malleable into this practice, then it's sort of tough. So we
Right.
actually, I think these are the skills we test at the clinic, at a company level, and that so far, over two periods, has worked, has not worked, but I
Yeah.
mean, it's a learning curve.
Yeah. Yeah, I do remember even Mahima telling me that flexibility is something that you actively look for when you're
Yeah,
looking for physios, because I think that flexibility plays a role in one, changing, pivoting, or just looking at it from a different lens.
yeah,
Because sometimes you're with a patient for so long in their journey that you kind of get lost in that pattern and you lose that sight of seeing it from a fresh perspective. So
yeah.
unless that flexibility is there, and then you understand motivators and everything, that all of
Yeah.
that requires flexibility over there.
I think, I'm sure Mahima mentioned, that is, we don't have hierarchy. I
Huh.
mean, uh, I would never call my colleague junior physio ever. Not because, like, I want to look really good at it, but I feel like there's nothing like that. I mean,
Hmm.
there are people with 15, 20 years of experience and not doing good practice. There
Hmm.
are people who have just started and they're doing so great at their work.
Hmm.
And I feel like that hierarchy, when you remove that whole
Hmm.
pressure of knowing it all or not knowing it, is changed. And I think that is something that we are trying to implement a little bit more,
Hmm.
by just ensuring that everyone's a colleague. Like, my 8, 9, 10 years of experience in ACL injury can still fall short for someone, or managed by someone who has got lesser than that.
Hmm.
But at the end of the day, again, flexibility makes that difference a
Hmm.
lot.
Right, right. Yeah. in a futuristic view, I think, do you think that physiotherapists will be valued more for their niche expertise, right? Or for their ability to integrate across specialties?
I'm a very hyper niche.
Yeah.
Sometimes it's not the best thing to be,
Hmm.
especially if you're running a healthcare company.
Hmm.
Like I feel like there are days, and I think there are many such days where I feel like I should know a little bit more about this, but I don't know because it's not my area of expertise.
Hmm.
Um, but when there is my area of expertise and that case emerges, um, I feel so strongly about it that I know that I'm going to manage this so good that probably no
Correct.
one else can manage it as great as I am doing. And that's not coming from a place of superiority, that's coming
Yeah.
more
Yeah.
from the point of view of that I know that I can deliver what it needs.
Yes.
So I feel like, um, how the whole saying was of jack of all trades, master
Hmm.
of none. But then
Hmm.
now there's an extension to it, like, better know it little of everything than everything of one thing. I
Hmm.
feel like that expansion has become a little important,
Hmm.
especially because when you like right now when I look at my footballer athlete, I'm not looking at concussion alone. Now I'm
Hmm.
actually looking at like this concussion when it becomes repetitive can also actually be a risk factor for dementia.
Hmm.
Dementia is not my area of expertise, but I
Hmm.
already know that if actually this person does great amount of cervical spine strengthening, manages concussion a little bit better, prevents the next concussion, his risk of having dementia is going to be a little lesser. So I'm
Hmm.
actually now thinking a bit more broadly
Hmm.
because now I'm trying to integrate a little of everything that actually does not fall in my expertise, but it's good to know,
Yes.
because I feel like in the past, the whole school of thought was manage an injury, but
Hmm.
now the school of thought is that manage the person as a whole.
Yes.
That's past, present, and also future.
Yes.
So I feel like I don't know which is going to be better. It's
Yes.
very hard
Yes.
to say.
Yeah.
But you need to have some expertise, some niche, but also some collateral information about like at least to know कि ये मेरा केस नहीं है मैं किसी को ट्रांसफर कर सकता हूँ
Correct.
like that
Correct.
much.
To get the required help, at least, to do the
Yes.
to do the justice. Yeah. Do you think that the current
Current
education system encourages specializations in the right way, or do you think that it needs a structural change?
it should have needed a structural change a long time ago. Everyone who's
Exactly.
currently practicing
Yes.
has, I think, gone over this over and over again. That there's so many things that we learn in the undergrad, and there's
Yes.
absolutely no use case of it. Like, I feel like, as I said, like, if critical thinking and reasoning is something that could have just been inculcated in us in the
Yeah.
first few years of us doing our undergrad, also, forget
Yeah.
specialization, would have
Yeah.
changed so much of our thinking, would have changed our confidence on the field, would have made us feel a bit more, like, I don't know, like a bit more secured in our field.
Hmm.
Because I personally feel that I don't know, the syllabus was revised uh, 15 years ago, 20 years ago, probably.
I don't
And
even think it was, but
it's it's really sad because I feel like they are still telling us, I don't know, like again, a very controversial school of thought that
hmm.
electrotherapy solves things. And I feel like electrotherapy has been such a debatable topic,
Yeah.
for everyone. And
Hmm.
again, there's no right or wrong way of answering that. But I feel like because our syllabus taught that and 50% of weightage was given to electrotherapy,
Yeah.
that to change that mindset,
Hmm.
not just from patient's perspective but from therapist perspective, also has become so difficult.
Yeah.
I feel like there are research talking about placebo effect
Hmm.
since, I don't know, 20-30 years ago ka papers, but our syllabus still teaches that as strongly as it would have years ago.
Yeah.
So I feel like education system does need to shift for sure. I feel, again, because I have done my undergrad in Mumbai and masters in UK, both of them are very different in approaches. Again, not one is better than the other or
Yeah.
whatever.
Yeah. Yeah.
I feel like in Indian education system, there's a lot of hand holding, there's a lot of like, we will teach you and this is what it needs to be done sort of a method, versus in UK there's absolutely no hand holding. They're like, there are these papers out across in the research, read and learn, and we will do an assignment out of it, you know.
Hmm.
So I feel like both of them are little extreme approaches.
Hmm.
um, I feel there needs to be a middle ground wherein the person is given a set of information and be like, but there's more than this. So
Yes.
please do the reading, you know.
Yes.
And I feel like that shift is very important,
Hmm.
um, because I think that can set your career a little bit faster than
Right.
what is right now.
Right.
Um,
Right.
yeah.
Do you think the answer to that would be, I mean, the answer to gaining that uh, clinical reasoning and all would be clinical mentoring?
Yes, yes, probably. I mean, a part of that, yes. I feel like, like, because I'm from a government college, we saw patients since week one of us being in the college,
Hmm.
and I felt like I saw patients, but I saw the patients so mechanically that I was told that 20 minutes ultrasound,
Yes.
or put them on the machine, or just go and give chest OTPT to the patient, or make them walk, but never a thought process of like, why are we doing
Yes.
like accelerated rehab in a TKR, or why do I need to actually give ultrasound for like, I don't know, 20 minutes,
20
or
minutes.
why do we have to give them exercises in acute, like there were so many things that I felt but never really like molded.
Hmm.
So we did so many, like I feel like almost that 4.5 years of seeing patients, not treating patients, just seeing patients, the whole experience could have been so different if you were
Yes.
just told to think about it, you know.
100%.
um yeah.
Yeah.
But
Yeah.
yeah, mentoring is, yeah, for sure, mentoring is something like I feel like, um again, it's, I think now people are shifting to that. Like I know
Hmm.
I know a few physios who come here for observership, and
Hmm.
they come when they're in third year itself, you know. And that
Nice.
kind of observership I only did when I was in my internship, and I feel like that I could have just done it much before that. But I feel like people are shifting that mindset, because if that academics does not give you that, they're just doing it by themselves, and it's just a good approach.
We are talking about both interdisciplinary care, multidisciplinary care for one patient, and also the need for specialization. And I think both exist, both coexist, right? Like you also need some specialized experts to guide you in that area, in that niche area, because care itself is moving towards a more personalized care. And you also need a multidisciplinary approach because you, I think nobody is just one thing, nobody is just one system, everybody is an integration, and that integrated care becomes important. Now when you think of it from a center or a clinic perspective, how does this how do you adapt your hiring strategies, or how do you change your hiring strategies in response to these trends, or what do you look for? I think flexibility is one thing that you had told us about, but is there anything else that you look out for?
um I think, okay, when we started off, because both Mahima and I, we are from different areas of expertise,
Mm-hmm.
and those two areas of expertise still stays quite on the top for Synergy India. That's your MSK and sports, and then there's geriatric
Hmm.
community neurocare, which comes, and when we started adapt, like getting in more and more patients in the clinic, we started realizing that despite I being really good with like strength and conditioning, performance, injury sides of it, I think I would need a little bit more from a very sole MSK expert to come and
Hmm.
manage this in a plateau phase.
Hmm.
So my hiring went in that direction of like, I need this to manage my injuries a little bit better. So our hiring was more of a cotton ball effect of understanding what we needed in the time, and then we hired.
Hmm.
For us, we knew for sure is that I can only give non-physio advice about certain things. Just say, for example, nutrition is the most common one. A lot of people would ask about nutrition,
Yeah.
right? And I can only tell them so much about proteins, so much about non-inflammatory food items. But then beyond that, I know that my knowledge is again short in
Right.
that area.
Right.
Not, I can probably read about it. I can
Right.
now bit more, like. chat GPT out of it. But I personally feel that there are experts who are much better at this than
Yeah.
I am for sure, right?
Yeah.
Because they hold that uh, education, skills, everything to manage that particular case better. So the idea was that we should know about these multidisciplinary care individual areas only enough to sort of tell people that you need this, but we want to hire people who understand that this is an important component of the whole management.
Right.
Like
Right.
my frozen shoulder case, I cannot always manage this completely by myself till I've put them on an anti-inflammatory diet. Like for me, an anti-inflammatory diet for such cases is absolutely important.
Yeah.
For me to get in touch with their diabetologist becomes absolutely really important.
Yes.
Me just understanding that let's say if that Parkinson's person has frozen shoulder, how to manage that, like just for me to understand that these are important components. If I were
Hmm.
to look at this patient as purely only shoulder case and
Hmm.
not as all these things, would become really tricky because you can
Hmm.
only manage them so much, right? So I feel like when we started this space, our idea was really clear. Whatever we need, whoever we need, we are going to get them on the team.
Hmm.
And that is our hiring has always been like that. Like
Hmm.
a few days ago, I was just thinking that I am a physio-led strength and conditioning expert sometimes, but I am because I'm a physio, it holds me back sometimes into performance.
Hmm.
Sometimes I feel like I don't push enough. But if there was a strength and conditioning sports science person, they would have just gone all in, right?
Right.
So I was just thinking I need to have someone who is a
Right.
non-physio performance expert,
Right. Right.
right? So I
Right.
feel like that, and then I'm actively looking for someone now in that
Oh,
direction. So I feel like our hiring has always been what we have right now, what we need, and what we can actually get,
right.
right?
Basically, you said that you need specializations and
Yeah,
you need them to, but they also need to understand that that is not the only thing that's going on with the patient and they
right.
need to be
Yeah,
ready to integrate and work. So you are looking for people who have that one mindset one and you also look for people who know their subject matter well. So when they know that there's a gap, then they can also refer and understand what needs to be done at that point. That's a great answer, and I do think that that's how it will go because I mean I also agree that that's how it will go because we are going towards a more personalized care scenario
mm.
where
Mm.
quality of life is mattering more than ever now. And it's not just I want to pick up my grandkids, I want to do this, I want to run a 10K, I want to be independent and do all my activities because my children are far, far away. So that quality of life is mattering from many different perspectives right
Yeah,
now. And
yeah,
I think these
yeah,
interdisciplinary, multidisciplinary care will help us to get there along with the right experts in the right direction. So
yeah.
that's really great. And thank you so much for taking out the time during your busy
No, it was
day.
really nice ways to have this podcast.
Yes, thank you. Thank you so much. And I really enjoyed talking to you and gaining your perspective on sports physiotherapy. And also, I think a lot of other things that physios would need to improve on their career, make a change in their career, reflect upon. I think it's been very reflective in that sense, the podcast.
Yeah.